To graduates, family, friends, faculty, and staff, today is the day. May 7th, 2016 is the day that we celebrate the outstanding accomplishments of the 2016 graduating class of the School of Public Health at Georgia State University. It is with great honor and pride that I stand before you all today to give you remarks as we celebrate this milestone in our journey to becoming esteemed public health professionals. The past several years have truly been a journey of discovery. Discovering what public health really is, discovering what I wanted to study in public health, discovering where my niche was in this dynamic field that encompasses so many different subject areas. For me, this journey definitely didn't start the way I had originally imagined. Prior to starting my MPH program, I began my undergraduate career at a women's college called Agnes Scott, not too far from here. And from the moment I stepped foot on campus, I just knew I was going to be a biomedical engineer. I knew it was going to happen. No one could tell me any differently. I declared my major in biology, took the necessary multivariable equations courses, the computer science classes, and I was completely committed to what I then thought was my ultimate goal. But then during my junior year, I found myself at a standstill, and I was no longer able to pursue my degree in engineering, and I found myself trying to figure out what my next steps would be like. All I knew is I wanted to be involved in the health arena and make a difference. But at that point in my college career, I wasn't sure what making a difference really looked like. So in my liberal arts education, I was able to take courses in public health, mathematics, women's studies, minority studies, and other innovative coursework. And in my year of discovery, I quickly began to realize how public health is truly integrated into all of my work. And I fell in love with the idea of attacking issues through different social avenues while also applying my background in math and science. So there I was, finishing my junior year and making plans to apply to grad school for a master's in public health, without any idea of what the future would hold, but still excited for the new discoveries to come. Now, although our stories of discovering public health are probably pretty different, I'm sure they all have one thing in common. We didn't all expect to be working in public health. So let's take a poll of our graduates. How many of you knew from when you were 5 years old, I'm gonna be a public health professional? Right. So not many of us, and I've always wondered why this is the case. So completing this program, I've discovered that this is because public health is so interdisciplinary and literally in everything. Because public health is so integrated into our day-to-day lives, it takes a team of talented individuals from various academic and professional backgrounds to work with communities and populations to identify causes of disease and disability and implement large-scale solutions to these problems. And that's where we come in. We have graduates as well as faculty with backgrounds in communications, anthropology, sociology, biology, women's studies, exercise science, policy, anthropology, biology, and the list goes on and on. Excuse me. So it just gives us a snapshot of how diverse and collaborative our field has become. Yet no matter what our backgrounds are, each and every one of us have stories of discovery of public health. And these stories are reminders of why we love to do the work that we do every day. These stories remind us that public health is the intersection of science, the active disease prevention, and disseminating information to protect and prolong the health of our communities. These stories remind us of the challenges we face as public health professionals and push us to develop innovative techniques to combat these challenges. And more importantly, public health pushes us to ask those critical questions. Who gets a certain disease and why? What can we change to prevent illness and harm among an entire population? What are the underlying systems that are driving health and health disparities in our nation? These are those tough questions that we have to answer. But the good news is we now have that foundation of skills and knowledge to begin to tackle these tough questions. Now, over the past few years, we're not the only ones who have discovered this world of public health and trying to answer these questions. Public health has captured the attention of many households worldwide with big headlines about the Ebola response in West Africa, the Flint, Michigan water crisis, implementation of the Affordable Care Act, and other natural disasters. And often, because of the work we do, we become that token public health person among family, friends, and sometimes even strangers. So you could be at your Thanksgiving dinner table enjoying your sweet potato pie when that one relative starts a conversation like, so what's going on with Zika? Like, can you tell me? Like, am I gonna get sick? What's going on with that? And if you're like me, you're like, let me check the CDC website. So with that, many of us in the audience have likely been that relative, but that's okay. Part of our jobs as public health professionals is to be informed about what's at the forefront of public health, and questions like that give us the opportunity to share our wealth of knowledge that we've acquired since beginning our program. When the ones closest to us ask us those questions and engage in enriching discussions about health, we are reminded of why we chose public health and why our journey of discovering our passion is never ending. These insightful questions are the ones that make us reflect on why we chose public health. I choose public health because there are individuals who have systematically been given greater obstacles to health because of their health, their race and ethnicity, region, socioeconomic status, disability, gender, and the list goes on. I choose public health because people of color are at disproportionate risk for being uninsured, lacking access to care, and experience worse health outcomes. I choose public health because despite only representing 12% of the US populations, African Americans account for 41% of the existing HIV cases in the United States. I choose public health because I truly believe that our ultimate goal of reaching health equity is attainable. So graduates, I challenge you to reflect on why you chose public health and why you continue to choose public health each and every day. As you reflect, consider the journey of discovery that you have taken and think about what that next leg of your journey will look like. I would be remiss if I didn't acknowledge the village of people for whom, without their support and encouragement, our journeys would not have been possible. To the School of Public Health faculty and staff, thank you for not only teaching us, but nurturing us. Your commitment and dedication to our development as public health professionals is incredible. You have acted as teachers, advisors, mentors, sometimes therapists, and even friends. You all represent what we aspire to become, and on behalf of the class of 2016, I say thank you. I would like to thank my personal village of friends, families, and mentors who have traveled this journey with me. Thank you for your unwavering support and love. Without all of you, none of this would be possible. To my fellow classmates, it has been such an honor to work alongside a group of incredibly talented and hardworking scholars. I couldn't imagine a better group of people to take this journey with. Let it be known that we are not your average graduating class. We're actually kind of a big deal. In our class, we have a future EIS officer, PhD candidates in various fields, ORISE fellows, future medical students, CDC contractors, nonprofit workers, and the list goes on. It just goes to show that that time spent in the biostat lab and the hours on problem sets and the agony of opening your thesis with those red comments was worth it. So here we are on the day. MPH candidates adorning their fashionable salmon hoods, and our PhD candidates in their impressive regalia. You are moments away from leaving your title as MPH candidate or PhD candidate behind and becoming a graduate. Those three little letters that we've all worked so hard for are finally ours. As you walk across the stage, keep in mind that your journey of discovery never really ends. Each day we uncover new things that make us love the work that we do that much more. And lucky for us, our career of service to improving the lives of others lead us to our journey of our own success. I wish you all the best of luck. Thank you and congratulations.